Okay, next issue up, healthcare reform. There was a big week last week for the Supreme Court, and that was one of the two major decisions that they came up with. Both appear to be victories for Obama. My opinion about healthcare reform is that I don't like it, bottom line. And the reason is because I don't think that it's the job of our government to compel us, force us in essence, to pay for something that we may not ever need. And health insurance is one of those things that, you know, some people may not need, or if they choose to, you know, to not, I guess, opt into it, although I don't know if that's a choice or not. I don't think it is under this plan. But I think that that should be how the system works. Give people the opportunity to opt in or out. And I'll explain why. There are people that, you know, for whatever reasons, they cannot afford the extra money that it would cost them to purchase this insurance. Bottom line, I mean, for whatever reason, whether they, you know, lost a job, or, you know, they lost all of their net worth, maybe a business failed, had a divorce, you know, they went bankrupt, whatever, and they could be, you know, in their 40s, 50s, and having to completely rebuild. Now, if that person goes out and, say, gets a job, and you know, they're at the point now where they do have extra money coming in, they don't have that much time to save for their eventual retirement. So they're going to want to put as much money as they can into, you know, retirement vehicles or any other investment vehicles that are going to, over time, hopefully produce, you know, some extra cash flow for them so that they can live in some kind of comfort in retirement. So for a person in that position, why would we compel them and force them, in essence, to pay an extra $500 or $600 a month for this health insurance that they may not need? You know, because there are plenty of people out there that are, you know, 50, 60 years old that are pretty healthy. They live healthy lifestyles, and they don't go to the doctor all the time. You know, I'll use myself as an example, because I lost health insurance quite some time ago, and I decided I chose to not continue because it was actually very expensive with the policy. So for myself, it was worth the risk because I was in that position where I was having to rebuild. So what are my current healthcare costs? Knock on wood, fortunately I've been pretty healthy. I only have one issue, and that's high blood pressure. My medication, using generics, $11 a month, and then I need a prescription to get the medication. I get that from my doctor, and I see him once, at the most twice a year, $80 per visit. So my health care cost, assuming I stay healthy, don't get sick and have to go see a doctor or go to the hospital, is $292 a year is what it adds up to, or in other words, less than $25 a month. Why would I go out and buy a policy that costs $500 or $600 to cover an expense that isn't there right now? I wouldn't do it. And the only reason why I would even consider doing it is if I suddenly had a large income, or maybe, you know, you won the lottery or something, you have a large you know, asset base all of a sudden. That's about the only reason. So, there.